I just wanted to thank Brian and Oscar for inviting me down here to talk about mammalian bites. I do want to point out that no matter what topic you can give me, I can relate it to underwater injuries. Remember that whales are indeed mammals, even killer whales. I do want to point out that we love our ICD-10, and there's even a code for killer whale bites in the ICD-10. Look it up, it's real. Crazy.
Is it orca?
It is orca. It is. So I'm going to add a little bit to Brian's lecture about tetanus. We often do point counterpoint, but Brian's lecture was just so good I couldn't find anything wrong with it, so I just wanted to add to it. He's hard to follow. We're going to talk about tetanus, and we're going to talk about what causes it, what it looks like when it presents, how to treat it, and then some of the complications to it, and then how to prevent it, how it's most important for our point of view. So tetanus usually comes when you have some sort of wound, but there's a difference in wounds. A wound that happens on the farm is very different from a wound that happens on a tennis court. Now remember, farm wounds are extremely bad for tetanus because tetanus is a gram-positive rod that's an anaerobe and a spore-forming bacteria. The spores are extremely resilient and they can pass right through your GI system and not be dissolved. So that's why there's a lot of them on the farm, because there's a lot of GI systems on the farm. All right? I put up a tennis player specifically because these bacteria look like tennis rackets. I want you to remember that because I've seen it on the in-service more than once where they say, we have a gram-positive rod on culture. What do you guys want to do with it, or what do you want to treat it with? So sometimes they ask these stupid questions on the in-service. That's why I put up a tennis player, because they look like tennis rackets when you have the spore inside that gram-positive rod. So presentation, how does tetanus present? Well, it presents like most infectious diseases. You get sort of a headache, malaise, fever, but it happens with a wound. All right, you usually have some wound where the tetanus is inside it and festering. There are some cases out there of people who have tetanus and no wound. So they get the presentation of tetanus, it looks like tetanus, you treat them for tetanus, they get better, but they have no wound in their body. It's uncommon, but it does happen. What happens is, tetanus forms this toxin called tetanospasm, and that causes your muscles to spasm. It usually occurs in the neck and the face first, because those are the shorter neurons, and it causes like laryngospasm, lockjaw. That's why tetanus is associated with lockjaw very much. But then it starts to become generalized and goes all over your body. Again, your tennis player reminds you of what it looks like on gram stick. As it gets worse, it tends to involve your whole entire body and puts you into this pose of an arched backwards like C. This is called epistetonus. And I can't remember who was working with me the other day, but I actually saw a patient with epistetonus. I was totally shocked. And I said, wow, does this guy have tetanus? That would be really cool. I've never seen that before. I looked all over his body, no wound, and I was like, well, maybe he's got that no wound tetanus. But then I started thinking about what's your differential for tetanus. And one of the things in there is rabies. So I asked this guy, have you been around a bat, a fox, other animals before? Any mammal can cause tetanus, except for lagomorphs. Remember rabbits with the big teeth, like Brian put in? Rabbits don't carry tetanus. Lagomorphs don't carry tetanus. This guy said no. I didn't think he would lie to me, so I didn't think it was rabies. I said, what else can cause that? And then I thought about dystonic reactions. I said, are you a psych patient? Do you take psych meds? He said, no. So I didn't think he was a psych patient. I didn't think it was a dystonic reaction. I didn't think it was tetanus. I was pretty sure it wasn't rabies. So I went to his chart and started to Google his past. Lo and behold, he was in the art building yesterday and got a shot of Halvo. Moral story is, patients will lie to you. Psych patients will definitely lie to you. So my guy had psych history. I gave him the Benadryl and his epistetonus totally went away. Pretty cool case. The other one that you'll see that's in the literature all over the place is Rhisis sardonicus. This is this typical smile where all your face is in spasm, showing your teeth, making your eyes really close. These are also always in-service questions. Rhisis sardonicus and epistetonus. This is the normal presentation of tetanus, by the way. There are some abnormal presentations also. Voiding dysfunction induced by tetanus. This guy was in urinary retention due to tetanus. But it took him a little while to figure it out. This guy came in with some muscle fasciculations, a little bit of a low-grade fever, and inability to void. And they really couldn't figure out what it is. So they called neurologists, they called the ID guys down, and they said, well, it could be tetanus, let's treat him for it. They treated him for tetanus, and he was able to void. So they assumed it was tetanus, but they have no real proof. But one of the uncommon presentations of tetanus. I do want to point out that that's an ultrasound in my lecture, because I believe in ultrasound. The other atypical one that we can sometimes see is called cephalic tetanus. This is actually really weird because it's the opposite of what you'd expect. In cephalic tetanus, your facial muscles droop. So instead of being taut and tense like Rhitis sardonicus, your facial muscles are all sagging. So here's a nice example. You can see that there's a little bit of ptosis, the cheeks are drooping, there's a little bit of turkey neck going on, and once given the treatment for tetanus, everything in the face tightened up very, very nicely. Of course, this could also be a picture from a plastic surgeon's website, but I'm not going to admit to where it came from. The second case is even more impressive. Here you can see that there's a lot of drooping in the face, there's some jowling, the ears are definitely low, and once treated for tetanus, everything became much, much more upwards pointed. So we've talked about the treatment for tetanus a few times, but what is the treatment for tetanus? The most important thing is ICU admission and supportive care. Remember that in tetanus, all your muscles are in spasm. This includes your chest muscles, probably your larynx muscles. So they really should be in an ICU being watched in case they get laryngospasm. Right, guys? Laryngospasm is really, really a bad thing. I do want to point out that no babies were injured in the making of my lecture, and none were intubated. You want to put them in a dark room. Any loud sound, any flashing light can startle them, and once you try to move your body and move the muscles, it sets off a huge cascade of muscle tetany. So anytime there's like something that's shocking or loud or stimulating, you don't want that. So put them in a dark room, just like our ICUs, right? You want to relax their muscles, so you want to give them Valium. Usually you start in the 10s or 20s range, but some people have gotten up into the hundreds as treating it. You definitely want to treat that gram-positive spore-forming rod with something that treats anaerobes and gram-positives. So metronidazole is the ideal drug, but I've seen plenty of cases where they use penicillin, erythromycin, even Vanco. It's a gram-positive, so even Vanco. All those were treated very, very nicely. TIG, tetanus globulin, you want something that's going to grab up that tetanospasmin and get it out of your system. So TIG is very important. And the most interesting part I found is you have to give them TD or Tdap. They said that having tetanus, having the disease, does not confer immunity to giving it again unless you've given them this drug. And I couldn't find out why that was. I looked all over, asked a few tox people, but I couldn't figure out. If anybody knows or figures it out, please let me know, but I couldn't find it anyplace.
At the medical school, I was told that the amount of toxin it takes to kill you is less than the amount that's actually needed for your body to make the response.
I believe it. Thanks, Mel. That's very interesting. So complications. Now, there's a lot of complications to tetanus as well. You have all these muscles pulling and all contracting at once against the lever. So it's not uncommon to get fractures. They pull so hard, especially if you're an older person who has some weak bones in them. Pneumonias are also very common. Think about it. You can't cough because all your chest muscles are in spasm. Your larynx and your GI tract is in spasm. So it's not uncommon to get regurgitation. So pneumonias from that are not uncommon. You're lying in bed, you can't move, your legs are sitting there, so you end up getting PEs. And then remember, we said before, you can get laryngospasm, that's one of the bad ones. Plus your esophagus also has issues, you can't swallow. So make sure you give them TPN, make sure you give them food, so during this time while they have the tetanus, they retain nutrition and they can make muscle. Prophylaxis is probably the most important thing that I can talk about today because this is something that we can do. It's much better to treat, or much better prevent it from happening, than to try and treat the disease and deal with the complications. And this is where you guys come in. The initial series is very, very important. Right? Babies get tetanus at 2 months, 4 months, 6 months, 15 months, and 5 years. The first 3 are the important doses. It's really important to get that. That's when you build up all your immunity. Again, no babies were injured in the making of my lecture. What does the CDC have to say on tetanus and about the prophylaxis? Well, if you didn't get your first 3 doses, then every single wound should get TD. Every single one 100% of the time. Not many 100% in medicine, right? If you didn't have your first 3 doses and it's anything other than a minor wound, then they should probably get TIG also. How many times have any of you guys given TIG? None, right? I've never given it either. But the CDC says if it's anything besides a minor wound, then you should probably give it. Okay? We see a lot of patients from other countries who don't immunize the same as we do, and we're not even asking about this. So I think it's our job as good ER docs to ask them where they grew up, did they have their initial tetanus immunizations. I think this is something that we can do that can prevent disease. If they had their 3 shots, then they probably don't need anything unless it's been over 10 years. This is what the CDC says. And then if it's not a minor wound, if it's anything else, then it's over 5 years. So should we be giving TD or Tdap? But we've seen a big resurgence in the pertussis cases these days, and that's probably because the older people in the baby boomer generation, those guys, their TD or their Tdap is worn off, and there's a lot more pertussis out there. So if we can protect our children and give them Tdap, or protect adults even, then you have much less pertussis out there. Again, no children were injured or made to cough in the making of my lecture. What about pregnant patients? This is extremely important for us. Normally we try not to give pregnant people any drugs because you don't want to interfere with anything. But I read one study that said pregnant people should get a dose of Tdap or TD in their second and third trimester. What those drugs do, Tdap and TD, is they make stimulation of the B cells, which makes more antibodies. And then these antibodies go across the placenta and provide immunity to the child, the unborn child, because antibodies can cross the placenta. So some people say you should give it to pregnant people in their second and third trimesters. This is kind of cool. When you give tetanus or Tdap, you want to know if it worked. Did they get immunity out of it? So this company invented this dipstick where you put a couple drops of blood on it a month or two after you get the shot, and they can tell if there's antibodies there. It's good and it's bad. It's good because it tells you if you're immune, you have antibodies. But sometimes you don't actually need antibodies to be immune. You could just have a B cell memory, and once you get stimulated by a disease, your B cells proliferate and make the antibodies. So the B cells may be just hiding there with no antibodies around. You'll still be immune despite this test being negative. So let's review. I can take any lecture you can give me, make it into underwater, and whales or mammals. I injured no children in making my lecture. Place your tetanus patients in a dark room with no stimulation so they don't get worse tetanus. Treatment is metronidazole or a gram-positive drug for anaerobes, Valium, TIG, and TD. I thank you guys very much.
Come across anything for like paralyzing these patients? If they're in the ICU and they're already intubated?
So they did talk about that when they talked about giving Valium. Obviously for the unintubated ones you shouldn't do it. But if they're intubated already and they're having a lot of problems, like they're having a lot of vomiting due to regurgitation, due to the stomach spasm, then you can probably get away with it. Remember that every time you paralyze somebody, it takes a while for those receptors to clear and get their strength back. So if you want to get them off a vent and you've paralyzed them multiple times over multiple days, it's hard for them to get their strength back and breathe. So you want to paralyze them the least amount possible, but there's definitely data that shows it helps if you're having a lot of complications.
The tetanus immunoglobulin, is that, how do we administer it? Is it like around the site or is it IV?
So it just goes intramuscular, but on the opposite side of the tetanus immunization. Because the immunization is a treated form of the tetanospasmin, and then you're giving the antibody to bind it, so it's just going to take it out of your system. So you give it in opposite arms, and it should work.
Is there anything that predicts laryngospasm, and is there any role for like preventative intubation or like?
So there was nothing I could find that predicted it. A lot of people believe, and this is just personal opinion, but a lot of people believe that you should prophylactically intubate your tetanus patients because they get laryngospasm. A high proportion do get it, but there was no data out there as to who should get it, who should not, and then many people did it, many people did not. So there's no data, it's just personal preference.
You mentioned animals with long teeth like rabbits, so does that mean that rats and mice are not tetanus?
So I said lagomorphs, rats and mice are rodents. So rodents can, but lagomorphs do not. Unfortunately, you have to know the difference, and we're not all rabbit doctors. So you just have to know the difference. But rabbits are lagomorphs, and rodents do carry tetanus. Lagomorphs do not.
And just for that, also don't confuse rabies and tetanus, right? So the rodents.
Oh yeah, you say tetanus or rabies? I didn't hear you.
Rodents, except the big ones like woodchucks.
So that is only for rabies. That's correct.
Right?
I misheard you.
Rodents are different when it comes to tetanus. Just an interesting historical point since we're here in Brooklyn. Roebling, the guy who started to build the Brooklyn Bridge, the older one, he, while he was building it, got crushed by a barge, wound up getting tetanus and dying, and then his son had to take over.
So you avoided getting bent, but got that. That's one unlucky dude.
Yeah.
Good question. So do we just not see as much tetanus in our practice because we
vaccinate against it so adequately, or because we're in an urban setting where we're just not, we don't
I
have as many.
think it's a combination of both. I didn't read anything specific on it, but my belief is it's a combination of both. We just don't see that much anymore because there's not that much soil around that we can get in contact with. Because tetanus does live on surfaces, but it's much more common in the soil.
But if you've gotten your complete series of tetanus, it's very, very protective. And the vaccine really works really well.
Just
And
until you
I've
get
seen it in
older.
urban settings, not for a long time. I saw it in drug addicts who never got immunized in the old days, and then got tetanus from dirty needles, you know, with stuff. But if you've had your complete series, it's almost impossible to get tetanus.
Until you get older, you have immunity until,
Yeah.
one paper I saw it said like 50s or 60s is when you should be getting another dose, but there's no definitive, like nobody's ever proven it. This is just consensus.
Did you see anything about the risk of like over-giving tetanus?
So yes, and they said no, there's no risk. That's why they say even when you're pregnant, you can give a dose in your second and third trimester because there's no risk.
It's like the drunks that fall and get tetanus like weekly.
They just said it doesn't do much, you don't need it, but it does, there's no risk for overgiving it.
They did-
Yeah, those guys, they must have like a billion, trillion, zillion antibodies. Anybody else? All right, thank you very much, guys, and Brian, thanks you all.